Welcome back to the show, Talk with Your Doc, and with me is Dr. Kurshal Dighe, and we are talking about coronary artery disease. Dr. Dighe, you were mentioning about various causes and the risk factors for the coronary artery disease. Now, suppose somebody's heart vessels are blocked to some extent, say 30%, 40%, somebody might have 80% or 90% blockage of the blood vessel. What are the symptoms?
So typically a patient who has severely blocked arteries will get chest discomfort, which is more of in the center of the chest. They feel like a squeezing or a tightness in the chest. And that typically occurs when they're doing some physical activities. So it's like a matter of supply and demand. So when their demand for blood-rich oxygen is high, when they're doing physical activities, if they're unable to get that blood-rich oxygen, then they have what we call as ischemia, and that relates to chest discomfort and tightness. With activity, we call this term as angina.
But that happens when the blockage is more than 75% probably. But what will happen if somebody has, like, say 30% block?
So if there is a 30% blockage, usually they will not have any blood flow limitation.
Okay.
So meaning that even if they are doing high amount of physical activities, day-to-day activities, or even exercise, their heart is getting enough amount of oxygen to be able to cope with that activity. So typically they will not have symptoms of chest pain that we call as angina at that time.
So then this 30% will gradually grow 40, 50, 60, 70. So how do we detect this earlier blockage? Is there any test, like, say, stress test? Can stress test help us to detect the earlier blockage?
So no, the stress test can tell you if you have a 70% or over blocked arteries.
Okay.
But because again, the stress test is when you do a treadmill exercise stress test, you're increasing the demand of your heart and you're checking for symptoms of chest pain, or you're looking at ECG for signs of ischemia, and that will only happen when the demand is high and the supply is less.
So somebody has a heart disease or coronary blockage, say 60%, but his stress test may be normal completely.
That's right.
And still this patient might have heart attack and he may suffer from the heart attack.
That's right. So as I said, as there is a deposition, this atherosclerosis process is like a continuous process. So initially these plaques that are formed are soft, and they have, we call like a toothpaste like a material inside, which is high in fatty tissue and cholesterol. If these plaques rupture for some reason, then the inside of this plaque, the fatty tissue, comes in contact with the blood, and it triggers a reaction to form a blood clot. And now the 40% or the 50% blocked artery from the plaque is pretty much 100% blocked because rest of the blockage is formed by the blood clot.
Blood clot, yes. So even though somebody has 50% or 40% block, but that patient may have acute heart attack and die because of heart attack, because that vessel has been eroded by the process of blood clot probably.
Right. So there are factors that can cause this lining of the plaque to be thin, and there are factors that can weaken this lining, or factors such as physical, emotional stress that somehow breaks this barrier. And this, once that barrier is broken, there is a trigger reaction where the cholesterol particles come in contact with the blood, and there is a process of platelet aggregation and clot formation, and the rest of the vessel is then blocked with a blood clot. So in together, half the blood vessel is blocked with a cholesterol particle, half of it is blocked, for example, with the blood clot. In total, there is no blood flow in this artery, and the heart muscle has no oxygen, and this is called as an acute heart attack.
So it's interesting you're saying is that any stress, whether physical or mental stress, can cause this damage to about 40 to 50% blocked vessel.
Right.
And most of us have 30 to 40% block anyhow, right? As we are developing it in our lifestyle.
Right.
So even we have a 40% block, but an acute stress, physical or mental, can cause us to die with the heart attack then.
That's right. So there are factors, some of them are beyond our understanding still, as what makes this plaque rupture. So there are, again, a patient who has more risk factors, being diabetic or a smoker or poor lifestyle, obesity, physical inactivity, all these factors probably lead to such an environment that when you have that physical stress, that you're not
Or
able to
mental stress,
or a
right.
mental stress, emotional stress, that you're unable to withstand it, and that somehow your lining of the plaque ruptures.
So it's very important to be physically active as well as mentally strong rather than getting stressed out with the day-to-day problems, because that can lead to heart disease probably.
More of, I should say, is more of a depression. So
Depression.
depression is one of now, we think as a risk factor. Again, if you're depressed, you're not paying attention to yourself, or you're not paying attention to your risk factors.
I've seen many young patients like in 30s and 40s, dying because of heart attack. And probably this might be the mechanism, or is there anything else you can think of?
Well, in some patients very young, they can have some coronary anomalies. And that is, again, beyond our control. You're born with some very bad circulation that you have risk of developing a heart attack. So we cannot predict those. So those are not in our hands.
Now, sometimes we have seen patients or people watching some match or soccer or football or cricket, and their favorite team loses and they die with a heart attack. What happens in that case?
So it's again the same as emotional stress. So if you're emotionally too excited,
Charged, yeah.
or you're emotionally too depressed, you have those trigger reactions into your body that can, trigger a reaction that can lead to this plaque rupture.
Plaque rupture and die immediately probably. Now, so investigations wise, what investigations can help us to diagnose our disease process?
So if somebody has symptoms of chest pain, which you call as angina, then it's advisable, first of all, get in touch with your physician or a
Cardiologist.
primary care doctor or somebody to either do a stress test or refer you to a cardiologist for some tests.
Right. What sort of testings are involved, like electrocardiogram, stress test? What are the other tests we can do?
So an electrocardiogram can just gives you a snapshot of the heart. It is a very valuable test if you're having chest pain,
Right.
to see what kind of heart attack you have.
But if you don't have chest pain?
If you don't have chest pain, then an electrocardiogram is just a snapshot of the heart, which tells you, it just gives you a lot of information. If you've had a previous heart attack, if you have factors of thickening of the heart muscle, or if you have some arrhythmias, so it is a valuable test. But if you're having no chest pain, it can't tell you you're having a heart attack or not.
Right. So then what do we do next?
So if somebody is having symptoms or they're not sure about their symptoms, then usually a first line test is what is a treadmill stress
Test, right? And that's what you were mentioning, that you walk on a treadmill and...
Right. So you walk on a treadmill, and again, it increases the demand of your heart. And all is doing is checking, is the supply of blood or oxygen enough for your heart?
Right.
And if it is enough, your stress test will be normal.
Right. So the stress test is useful if you have more than 90% block or 70% block.
Right.
And then if it is less than that, the test might be negative also.
That's right.
So there are many more investigations which we can do and many more things to talk about ischemic heart disease. And our time is the limitation factor. So we'll continue this discussion in our next episode.
Sure.
Thank you, Dr. Dighe. Thank you everyone for watching this show, Talk with Your Doc. Next part of the Talk with Your Doc show will continue with the discussion on coronary artery disease or heart attack. Thank you.